Assalamualaikum and good morning. So I'm Miss Narisma Dismani, and for this video, we are going to tackle about the hepatitis. So ano nga ba yung hepatitis? Hepatitis, this means the inflammation of the liver. Opo, nag-inflame po yung liver natin through the causes of the viruses. So yung tanong, paano ang hepatitis nadadamage na yung liver? Or how the hepatitis viruses damage the liver. So, it is because of the infection that causes liver inflammation and damage of the liver. Inflammation is swelling that occurs when tissues of the body becomes injured or infected. Inflammation can damage organs. So, ano yung dahilan ng pagka-damage ng liver? So, through the foods or the viruses na pumapasok sa liver natin, or nako-contaminate tayo ng mga positive na hepatitis patient or individuals. So, next tayo. So, viral hepatitis is a systemic. So, ano nga ba yung systemic? Systemic is as a whole. Like for example, hepatitis A, B, C, D, E, G, and G, B, and C. Like that is a systemic. So, viral infection in which necrosis, or this means the death of body tissue, and inflammation of liver cells produce a characteristic cluster of clinical, biochemical, and cellular changes. So, let's start with the hepatitis A virus, or HAV. It is caused by a virus that infected liver cells and causes inflammation. And this is contagious. What is this means? Contagious is no treatment. Okay? But if you are willing and believing in yourself that you can be cured, then there is a possibility that this disease ay mawawala. So, ano nga ba yung dapat mong gawin? Balance diet and nutritious foods, exercise, and other treatment or preventive measures that you must do or follow, then may tendency na gagaling ka. Next tayo. So, causes through sexual contact. So, what is this means? Through sexual contact. From one person to another person. Like for example, if yung dalawang couple is yung lalaki is nag-cheat, tapos yung nakipagtali siya sa kabit niya, and then yung kabit niya is infected or positive from hepatitis. So, yung tendencies, makukuha niya yung virus sa kabit niya, and then madadala niya sa wife niya kapag nakapagtali siya sa wife niya. Then yung tendency kapag yung wife niya ay naging positive, pag nabuntis, mahahawaan yung bata. Kawawa yung bata, di ba? Pag kapanganak pa lang ng bata, kaya kailangan ng immunization is para kahit mabawasan man lang yung or maging protected siya sa hepatitis B or sa hepatitis. Kaya kailangan paglabas ng bata is kailangan na siyang immunize. Through vaccine of hepatitis. So for those cheater out there, please never cheat on your wife. Especially kapag yung babae na tinatalik nyo or kabit nyo is hindi nyo kilala kung sino-sino na lalaki yung nakatira sa kanya. For example, positive siya. Yung tendency, magiging positive ka. So kapag nakapagtalik ka sa asawa, yung tendency din is magiging positive yung wife mo. Kapag yung wife mo nabuntis, magiging positive yung anak mo paglabas ng bata. So let's move on to sharing needles, syringe, other drug infection equipment. So, these sharing needles, like for example, or the syringe, like for example, you are injecting a person that you don't even know if that person is positive in hepatitis. So yung tendency kapag na-prick ka ng needle, yung tendency is mahawaan ka nung patient mo ng hepatitis. So next tayo is through fecal or saliva, even just tiny amounts. So fecal is, like for example, uminom ko ng tubig. Painom ako ng tubig. Tapos, yung kaibigan mo or yung ininuman mo, gisharean mo ng baso is positive sa hepatitis. Yung tendency is pwede kang mahawaan nun through the saliva. Kasi kapag uminom ka nung pinag-inuman nung positive person, magiging positive ka rin if na-contaminate ka ng laway niya. Like for example, nakapag-share ka naman ng foods. Nakipag-share ka ng foods with sauce. So, yung tendency, magiging positive ka kapag yung dala mong magkumain is positive. Sorry for you. Even just tiny amount, kahit konti lang talaga, is mahahawaan ka pa rin. Because viruses cannot be seen, right? So, this is a tiny, sobrang liit ng virus. Hindi natin makikita. Makikita through microscope, yes. But it can spread easily kapag napunta na siya or na-contaminate ka na. So, yellow skin or eyes. Yellow skin or eyes, for example, jaundice. And the next is the not wanting to eat or wala kang appetite kumain. Wala kang ganang kumain. And then upset stomach. And then throwing up, diarrhea, timatay-tay ka, stomach pain, fever, linalagnat ka, dark urine, or light-colored stools. Dark urine, kapag yung umihi ka is parang dark na siya, is hindi na siya normal, make it sure na at least drink a lot of water every day. At least 9 glasses or 8 glasses per day. And then, light-colored stools. So, one of the signs and symptoms for hepatitis A virus is that what I've mentioned. So, what are the assessment? Assessment is reducing the demands of the liver while promoting physical well-being, preventing complications of hepatitis, enhance self-concept, acceptance of situation, providing information about the disease process, prognosis, and then treatment. Okay, next tayo. Nursing care plan and nursing diagnosis for patients with hepatitis. Imbalanced nutrition, less than body requirements, risk for deficient fluid volume, fatigue. We all know fatigue is madaling mapagod, right? So, risk for impaired skin integrity, deficient knowledge, situational low self-esteem, risk for infection. Next tayo, diagnostic findings. An HAV or hepatitis A virus antigen may be found in the stool 7 to 10 days before illness and 2 to 3 weeks after symptoms appear. HAV antibodies are detectable in the serum. So, next tayo is the prevention. So, educate your patients regarding safe practices for preparing and dispensing food. So, when you are going to have or preparing for food, make it sure, or when you are cooking the food, make it sure it is washed well. Kailangan maging malinis bago mo iluto para hindi siya contaminate ng kung ano-ano mang virus or microorganisms. Para healthy talaga yung ma-intake mo or makain mo na food. Next is encourage conscientious individuals hygiene. kailangan mo din i-encourage yung patient mo or the person or individuals na mag-hygiene through hand washing or something hygiene that is really needed in our daily life. Next, encourage proper community and home sanitation. Home sanitation, kailangan mo linisan yung mga bahay, yung mga gilid-gilid is kailangan mong i-clean talaga para maging or avoid tayo sa infections or the microorganisms and viruses. Hindi naman maiwasan ng microorganisms and viruses, but make it sure na hindi ka mahawaan sa sarili mo and make it sure that your home is clean. Next is the facilitate mandatory reporting of viral hepatitis to local health departments. Next, promote community health education programs. Like we can example the seminar. Okay, then promote vaccinations to interrupt community-wide outbreaks. Promote vaccination, immunization, give the this baby or infants the vaccination for hepatitis. Next is the recommend vaccination for all children 12 to 23 months of age. Continue existing immunization program for children 1 to 18 years of age. Why? Because it is protected from any viruses or contagious diseases or diseases na pwede tayong mahawaan. So, ma-avoid natin yon or maiiwasan natin yung mga diseases kapag nag-take tayo ng vaccination of the hepatitis or other vaccination. So, next is recommended vaccinated for travelers to developing countries, illegal drug users, injection of non-injection drug users. Men who have sex with men, people with chronic liver disease, people who work with HIV-infected animals, or work with HIV research products for clotting factors disorders. So, kailangan natin yung maging vaccinated para maiwasan yung mga to. Okay? Iwasan din yung makapag-sex or bisexual, for example, men to men. Make it sure that is avoided. Use your protective gamit para maiwasan yung ganyang sakit para hindi ka makontaminate ng positive one. Next is the support effective health supervision of schools, dormitories, extended care facilities, barracks, and camps. And then, sewage disposal. Make sure that every mga maduduming bagay-bagay is kailangan mo dapat itapon kung sa nararapat na lalagyanan. Huwag mo lang itapon kung basta-basta. Kasi pwede yung mga feces or mga stools, pwede yung makakontaminate kapag yung nagtae is contaminated, pwede ka makontaminate pag nahawakan mo yung or kung ano-ano na naapakan mo yung stool ng tao na yon. So, nahawakan mo, kinuha mo yung tsinelas mo, naghugas ka, hindi masyado malinis yung paghugas mo, tapos kumain ka. Yung tendency, yung virus is nadadala na sa kamay mo, and then nakain mo na. So, yung total cases sa 2017 and 2018 is 3,366 and 12,474. This is a reported cases. Then prolong of illness it's 4 to 8 weeks or death. The death is fulminant hepatic failure. If hindi naagapan, pwede siyang mamatay. Then the vaccines for the hepatitis A is the Havrix-Vacta, effective 90% to 100% after 2 to 3 doses. Okay? So, medical management. What is the medical management? Bed rest, during the acute stage, and a nutritious diet are important aspects of treatment. During the period of anorexia, the patient should receive frequent small feeding supplemented if necessary by IV fluids with glucose. Next tayo, nursing management. Educate the patients to seek additional health care if the symptoms persist or worsen or lumala. Dapat mag-educate tayo sa pasyente natin para sa additional health care nila para kapag yung symptoms ay lumala. And then have ask and educate patients to maintain the balanced diet, to rest, follow up about blood work, avoiding alcohol, maintain hand hygiene. Never forget to maintain hand hygiene kasi ito yung pinakamaduming part ng body natin. Next is the rationale is to prevent spread of the disease to other family members. Tama yun. Para kung mahal mo yung family mo, never ever be contaminated. And the only way is to have or maintain the hand hygiene or the hygienic procedure. So next tayo is hepatitis B virus or HBV. The function is a serious liver infection that causes inflammation, swelling, and riddling that can lead to liver damage. So same din, di ba? Like the hepatitis A, nadadamage yung liver. Kasi nga yung hepatitis is the damage the liver by a viruses of A, B, C, D, E, G, and other viruses that infected the liver and inflame the liver or damage the liver. So hepatitis B, also called HBV and Hep B, can cause cirrhosis or hardening or scarring, liver cancer, and even death. So what are those causes? It is through the blood. Yes, through the blood. Kapag ikaw ay nahawan ng blood, for example, may sugat ka. May sugat ka. Tapos yung sugat mo is napahiran nung blood. Yung tendency is yung virus papunta doon. Pwede kang mahawaan. Next, through saliva. Saliva is laway, di ba? So, kapag nakipag-share ka ng foods, ng iinumin, so yung tendency, kapag if yung na-sharean mo is positive sa hepatitis B, so yung tendency is mahahawaan ka din nung virus kung anong merong virus sa kanya. Like hepatitis B virus. So, make it sure kung umiinom ka, galing sa'yo. Pumili ka, huwag kang makikishare, lalo na kung may pera ka naman. O, diba? Magtiis ka, umuwi ka sa bahay niyo, uminom ka ng tubig niyo doon, or kumain ka doon. But if the foods is, hindi naman, makikita mo naman hindi naman makakontaminate, then, you can share. But avoid contamination of the foods and from the water you are drinking or you are sharing with your friends. Next is vaginal secretions. So the vaginal secretions, which is as based on the research, this means that when you are having sexual contact with that person positive, so tendency you will be also contaminated. And also if you are positive, then that person will be contaminated because of that vaginal secretions. So what is this mucous membrane? Mucous membrane is, the question is, why mucous membrane the cause of the hepatitis B? It is cause of hepatitis B virus because it enters the body through a cut, scrape, and also which is scrape area of skin or through mucous membrane. ito yung sugat-sugat sa labi. So, yung breaks in the skin naman is kumbaga kapag yung kamay mo nasugatan, easily contaminated yan. Kasi open yan eh. Open sa sugat, open sa any microorganisms or viruses, papasok agad yan dyan. Kaya be careful kung nagkasugat, dapat linisan agad at gamutin. So, what are the signs and symptoms? Signs and symptoms are loss of appetite, wala kang ganang kumain, dyspepsia. So, this refers to discomfort or pain that occurs in the upper abdomen. This is after eating or drinking. It is not disease but a symptoms. Okay? Dyspepsia is a common problem affecting up to 30% of the population. Okay. Symptoms include bloating, discomfort, feeling too full, nausea, and gas. Para kang nahihilo, hindi mapakali, hindi alam kung anong gagawin, parang nahihirapan, masakit yung tiyan, parang ganun yung dyspepsia. Abdominal pain, ando na sa dyspepsia, abdominal pain, sakit yung tiyan mo, is one of the symptoms of the hepatitis B virus. Generalized aching, masakit, di ba? And then malaise, and then weakness, mahina. Nanghihina ka, always. Yun na nga, wala ka nang ganang kumain. Ba't hindi ka pa kaya manghina, di ba? And furthermore, further explanation is the liver may be tender and enlarged to 12 to 14 centimeter vertically. And also the spleen is enlarged and palpable. And posterior cervical lymph nodes may also be enlarged. What are those assessment? So, blood tests can detect signs of hepatitis V virus. It can tell whether chronic or acute. It also determines if you're immune to the condition. Liver ultrasound, cold transient elastography. That is can show the amount of liver damage. So that's why you need to consult the doctor if you experience signs and symptoms as the healthcare providers para ma-guidean ka at para maagapan yung disease na to. Next is the diagnostic findings, which is HAV is a DNA acid virus composed of the following antigenic particles. So what are those composed of the antigenic particles? What are those antigenic particles? It is the HBCAG, which means hepatitis B core antigen. And then HBsAg, hepatitis B surface antigen. So yung sa C, 'di ba, yung sa first is core antigen, and the second is surface antigen. Then the third is which is the HBeAg, independent protein circulating in the blood. And then lastly is the HBxAg, which is the product of X gene of HBV DNA. So each antigen elicits its specific antibody and is a marker for different stages of disease process. So anti-HBC, antibody to core antigen of HBV. Next, HBs is antibody to surface determinants on HBV. Anti-HBe, antibody to hepatitis B. Antigen usually signifies reduced ineffectivity. Next is anti-BXA, HBXAG antibody to the hepatitis B X antigen may indicate ongoing replication of HBV. So, the prevention, which is health promotion. Then avoidance of high-risk behaviors, avoid multi-dose vials in patient care settings, and then monitor cleaning. Always tayo maglinis, mag-disinfect, which is the disinfection and sterilization of reusable devices in patient care settings. Dapat sterile lagi ha, para di ma-contaminate yung patient na to. Para hindi ma-contaminate yung patient natin at hindi tayo ma-contaminate. So, next is recommend vaccinations for international travelers to regions with high or intermediate levels of endemic hepatitis B virus infection and for persons with chronic liver disease or with human immune deficiency virus infection. Next is recommended vaccinations for all infants regardless of the mother's hepatitis B. Immunization after the birth. Kailangan ng immunize yung bata or the infant. So, use barrier precautions in situation of contacts with blood or body fluids. Use needleless IV and injection systems in healthcare, and then use standards, precautions in clinical area. So, what are those risk factors? Risk factors is close contact with carrier of HBV. So, kailangan nating umiwas. Iwas-iwas sa mga taong positive sa HBV. Hindi ka maarte, umiiwas ka lang kasi yung tao na yun is positive. Hayaan mo kung tatawagin kang maarte or kung ano-ano. At least, you are safe. Next is frequent exposed to blood products, or other body fluids. Kaya, like, kailangan din mag-wear ng gloves para hindi ka ma-contaminate, maghugas ng kamay or mag-hand hygiene throughout the day. No, throughout the day, every day. Kapag may gagawin ka, please do hand hygiene. Next is the healthcare workers, hemodialysis staff, oncology and chemotherapy nurses, personnel at risk, needle sticks, operating room staff, respiratory therapy, surgeons, and dentists. Sila yung mga risk factors. Kumbaga, malapit sa panganib. So, they need the sterilization or the disinfections or the hygiene every single time kapag may gagawin silang procedure in this kind of area. So, next is the hemodialysis. Next is IV injection during drug use. Bawal kang ma-freak. Kasi, previous topic na nasabi ko is, but may tendency na mahawaan ka if the patient is positive of hepatitis. Next is male homosexual and bisexual activity. So, this must be avoided. Bawal na nga sa juice tapos gagawin pa, di ba? So, to avoid, hindi naman natin I'm not against the LGBT, but please be careful. Be careful. Kasi, kayo yung at risk sa virus na to. Kapag nakipagtali ka sa isang same-sex person or individuals, then you will be contaminated if that person is positive. Right? Paano na kaya kapag ikaw ay nakipaghiwalay sa bisexual partner mo before and then nagkaroon ka ng asawa mo, then positive ka sa hepatitis, then yung tendency mahawaan mo yung asawa mo, di ba? Like what I've tackled previously, like kapag yung mother ay kapag na-contaminate yung wife mo is mako-contaminate din yung bata kapag nabuntis yung mother, diba? Next is eto na mother to child transmission. Kapag yung mother is positive, yung tendency yung sa loob ng tiyan ng mother is maging positive paglabas ha. Kaya kailangan talaga ma-immunize kapag labas na agad ng bata. Kailangan siyang i-immunize. And then, multiple through the time or kung ano yung oras na date para sa immunization ng bata. Must be continue to prioritize. Next is the multiple sexual parents. Papalit-palit ng sexual parents. This is kapag nag-cheat. Tama? Kasi hindi ka naman makukontaminate kung hindi ka nag-cheat, diba? Hindi ka makukontaminate kapag hindi ka nag-cheat. Unless you are taking or eating the foods that is avoided or bawal na kainin, pero kinakain mo palagi without even drinking lot of water every day. So, yung tendency is magiging positive ka from the hepatitis. Sorry for you. Next is receipt of blood or blood products. Example, the clotting factors concentrate. Then next is recent history of sexually transmitted infection. Ito yung recent history of sexually transmitted infection. Like in example kanina, kapag yung positive ka tapos nagkaroon ka ng bagong partner, and then yung tendency yung bagong partner mo is mahahawaan. Or ikaw mismo na hindi positive, pwede ka mahawaan ng boyfriend or girlfriend mo kapag yung boyfriend-girlfriend mo is nagkaroon ng past relationship na yung taong yun is positive. Yung sa last relationship niya is positive yung partner. So, sorry for you. Be careful. Tattooing also can be risk factors of this virus. And then travel to or residence an area with uncertain sanitary conditions. Uncertain sanitary conditions, nakipaghalubilo ka sa mga tao, travel ka sa karamihang tao without doing sanitations or hygienic procedure. Tendency, magiging positive ka. Next is the total cases. Total cases is 868,000. O, diba? Ang dami. Chronically infected through the HBV or the hepatitis B virus. Next is prolong of illness is more than 6 months for the positive of HPV. What are those vaccine? Energix B, Recombivax HB. Okay na. Next tayo is the medical management. Bed rest may be recommended until the symptoms have subdivided. And then activities are restricted until the hepatic enlargement and levels of serum and liver enzymes have decreased. Adequate nutrition should be maintained. Proteins are not restricted. And then measure or protein intake should be 1.2 to 1.5 gram or kilogram per day. Must do. Okay? And then measures to control the dyspepsia emetic symptoms and general malaise include the use of antacids and anti-emetic agents. But all medications should be avoided if vomiting occurs, okay? And then if vomiting persists, the patient may require hospitalization and fluid therapy. So, next po tayo sa nursing management. Follow-up visits by a transitional and then assess the patient's progress. Answer the family members' questions about disease transmission para naman ma-aware sila at ma-aware yung pasyente at ma-aware kung anong gagawin sa pasyente at kung ano yung dapat na gawin nila para hindi sila makontaminate ng pasyente or family members nila na hospitalized. Okay? Next is during home visits, the nurse assesses the patient's physical and psychological status and confirms that the patient and family understand the importance of adequate rest and nutrition. Nutrition must be followed. Good nutrition must be followed. Good foods, lot of nutrients. That is the prescribed from the healthcare provider. Okay? And then reinforce the previous education. Previous education about this disease para maging aware naman sila. Hindi sila mawala kung ano yung dapat nagawin sa taong ma-positive sa hepatitis. Okay? So, next tayo, hepatitis C virus or HCV. So, the function is, or the causes is, people who are at particular risk for HCV include those who are use IV or injection drugs. People who sexually active with multiple partners, as I've discussed previously. Magkikipagtalik ka sa one person to another person to another tendency magiging positive ka, hindi mo na alam kung saan mo nakuha yung hindi mo na alam kung saan mo nakuha na yung sakit na yun pala sa kipagtalik ng iba't ibang babae or lalaki. So avoid being a cheater for your safety din naman sa relasyon nyo at sa sarili mo, di ba? Next tayo. Patients receiving frequent transfusion. Those who requires large volume of blood and healthcare personnel. So what are the signs and symptoms? The bleeding easily, madaling dumugo, and then bruising easily, madaling or sa tao mangalum, mongay mangalum, or mongay magkaalum beto. So, next is fatigue or madaling mapagod. And then, poor appetite. Wala kang ganang kumain, mahina ka kumain, ayaw mo kumain, tamad kang kumain. That is the signs of the hepatitis C. Next is yellow discoloration of the skin and eyes. We can call it a jaundice. Symptoms na din yun. Okay? Or the signs. And then dark-colored urine. Dark-colored urine, you must drink a lot of water every day to avoid this kind of symptoms. Okay? Next is itchy skin. Laging nangangat yung skin mo. Hindi mo alam kung ano yung dahilan. Yun pala yung kaya nangangating skin is through the inside of your skin. At that means that you are already contaminated with a positive one. Next, fluid build up in your abdomen, ascites, and then swelling in your legs, manghuwagin, paa. And then weight loss, mataba ka tapos pumayat ka from the 50 or 48 kilogram magiging 39 ang payat, diba? Because of the signs and symptoms, because of the viruses, or kawala mo ng gana sa lahat, is tendency mangangayat ka. Tama? And then confusion, drowsiness, and slurred speech, hepatic encephalopathy. Sorry. And then spider-like blood vessels on your skin, spider angiomas. Next is every chronic hepatitis C infection starts with an acute phase. So hepatitis C usually goes undiagnosed because it rarely causes symptoms. Yun yung acute hepatitis C. Okay? Next tayo, when signs and symptoms are present, they may include jaundice, fatigue, fever, nausea, and muscle aches. Sakit yung muscles mo, parang hindi mo alam, kung hindi mo naman alam kung anong dahilan, wala ka namang ginawa, bigla-bigla na lang sasakit. That is one of the symptoms of hepatitis C. Okay? Acute hepatitis C infection doesn't always become chronic. Yes, some people clear its CV from their bodies after the acute phase. An outcome known as spontaneous viral clearance of SVC or the SVC. Yes, tama po. And studies of people diagnosed with acute HCV from their bodies, rates of spontaneous viral clearance have varied from 15% to 25%. Diba, madami? Then acute symptoms appear 1 to 3 months after exposure to the virus and last 2 weeks to 3 months. Gets mo? Gets nyo po? And then next is the prevention, which is health promotion. Advise avoidance of high-risk behaviors such as IV drug use. This is similar to the other viruses. Yung prevention na, okay? Avoid multi-dose vials in patient care settings. Monitor clean, disinfection, and sterilization of the reusable devices in patient care settings. Use barrier precautions in situations of contact with blood or body fluids. Use needles, IV, and injection system in healthcare. Use standard precautions in clinical area. Gets na? So what are those risk factors? Risk factors is children to women infected with hepatitis C virus. Healthcare and public safety workers needle stick, injuries, or mucosal exposure to blood. Mucosal exposure to blood, yung skin mo exposed sa blood. For example, nag-inject ka and then yung skin mo nahipan ng dugo. Then tendency pwede ka mahawan ng virus na yun if positive yung inassessan mo. Next, the injuries. Yung needle stick, yun na yung sinasabi ko. Then next is multiple contacts with hepatitis C virus infected person. Multiple contacts with hepatitis, kung sino-sino na yung nakausap mo, nakasex mo, hindi mo na alam, infected person na pala yun. So sorry for you, but you are contaminated. Okay? Be careful. Next is the multiple sex partners, history of sexually transmitted infection, unprotected sex. Multiple sex partners. Kung sino-sino yung dinala mong kipagtalik sa'yo, you didn't even notice na positive ka na pala sa hepatitis. Paano? Multiple nga. Kung sino-sino, hindi mo na alam yung the recent na partners mo nakatalik mo is positive. So sorry for you, you are contaminated. Next, the history of sexually transmitted infection. Yun na yung sinabi ko previously, like kapag yung partner mo is may other past relationship tapos na-contaminate siya nung partner sa past relationship, yung tendency kahit hindi ka positive, magiging positive ka pa kapag yung partner mo is naging positive. Okay? Is positive. So next is the unprotected sex. So based on my research, use condoms to protect you and protect the person who has sex. So be careful. And for those who are not yet married, please be avoided for having sex. Maghintay na lang kayo. Darating din yan. Next is the past or current illicit IV injection drug use and recipient of blood products or organs transplant. And then before the 1992, so yung itong recipient of blood products na to, like for example, hindi mo alam yung blood, siguro naman ginitest naman nila to, like for example, nagpa-transplant ka ng blood. Nagpa-transplant ka ng blood is not totally yung blood, malinis. Tendency, positive, may pala yun, may virus pala yun. So, yung tendency kapag nag-transplant sa'yo is magiging positive ka rin. So, sorry for you. Just be careful. Next is the before 1992 or clotting factors concentrated before 1987. So, matagal na to. So, next tayo, hepatitis D virus, which is the functionate delta agent infection occurs in some cases of Hep B or hepatitis B. So the cause is because the virus requires HBsAg for its replications. Only people with Hep B are at risk for hepatitis D. So the infection is contagious and spreads through direct contact with bodily fluids of an infected person. It can be transmitted through the urine. Opo. Ihi. Next. So, kaya kapag naglilinis ka ng pasyente, kapag naglinis ka ng pasyente mo, nag-assist ka ng pasyente mo para maging comfortable siya, dapat mag-wear ka ng gloves. For your safety and for the patient's safety. Okay? Next is the signs and symptoms. So next is signs and symptoms. Yellow skin and eyes. So same as the other signs and symptoms, other viruses signs and symptoms. So this can also be jaundice. And stomach upset and pain in your belly. Sakit in tiyan mo. Throwing up. Fatigue, na-mention ko na kanina, madaling mapagod and not feeling hungry, walang ganang kumain, parang hindi ka nagugutom, and then joint pain, sasakit yung joint mo, and then dark urine, so you must maintain 9 glass of water per day or every day, and then light colored stool. So kapag yung symptoms na to ay nakita mo sa yung sarili or na-obserbahan mo is you need to consult the doctor for your safety para din maagapan if you are positive in the hepatitis D virus. Okay? Then next is the prevention. So in the prevention, you need to avoid sharing drugs equipment such as needles, spoons, needles like injection like that. Pag napinprick ka, tendency, magiging positive ka. Like mention ko kanina, if yung pasyente is positive sa hepatitis D or other diseases na pwede makontaminate, makontaminate ka talaga pag ikaw ay napinprick kapag na-inject ka sa pasyente mo tapos nasugatan ka ng needle. Posibleng magiging positive ka rin. Possible talaga yon. Then spoons. Don't share spoons. Kasi yung spoons, nandun na yung saliva, di ba? May laway na yan po pag nag-share ka ng spoon. So, pag kumain ka, huwag kang tatamad-tamad, kumuha ka ng sarili mong spoon for your safety and for the safety of a person beside you. Okay? Filters, and then cokers. Cokers must be clean. Cokers must be clean. Yes. And cokers must be avoided from other person who is positive from hepatitis D virus. Then pipes. Straws, yes. Yung, ano yan, known yan. Like for example, nag-share kayo ng inuman. Like for example, Sting, soft drinks, or water man yan na nag-straw ka. Tapos, uminom ka din kasi nauuhaw ka. Nakishare ka sa kanya, sa straw niya, na pinag-inuman niya na dati. Tapos, positive pala siya. Yung tendency, magiging positive ka rin kasi yung saliva niya is nandun na sa'yo. Is kahit kaunti lang or tiny amounts of that, virus, or kahit kaunti lang talaga, magiging positive ka pa rin. Mag-spread pa rin yung virus sa katawan mo or sa liver mo. Okay? Next. So, practice safe sex. So, this is according to research, use condoms and dental dams to reduce the risk of getting sexually transmitted infection, including hepatitis B. So, dapat maging protected ka when you are having sex with that person. So, next is avoid dental, medical, or cosmetic procedures that penetrate the skin with unsterilized equipment. So, must be avoid the blood transfusions, acupuncture, piercings. Yung piercings, yung earrings yan. Piercings yan. And then tattoos, must be avoid. Kasi, pag hindi sterilized yan, pag hindi sterile, possible, madumi yan. So, magiging positive yan. Magiging positive ka kapag yan ay may virus, which is positive sa hepatitis D. Sorry for you. And then, next is wear latex gloves. If you are likely to be in contact with someone else, blood, or bodily fluids. Okay? Hulas niya, pawis niya, dugo niya, kapag you are likely to be in contact with that someone, you must be wear the latex gloves. Okay? Avoid sharing personal items like, for example, razors. And then, scissors, gunting. Nail clippers. Nail clippers, dapat meron ka niyan kasi hindi naman yun mahal, mga 10 pesos, 5 pesos lang yan, makakabili ka na. At least di ka pa ma-infect ng mga that kind of viruses, magiging safe ka pa, di ba? Then, toothbrush. Please avoid toothbrush kasi kahit laway lang or kahit true fecal is magiging positive ka na. What more pa kaya kapag ginamit mo yung ginagamit niyang bagay na as in ginagamit pa sa bibig. Sorry for you, but you are already contaminated if that person is already contaminated or positive from hepatitis D. So, what are those risk factors? So, the risk factors is the intravenous drug use, the sexual intercourse with infected individuals. So, pabalik-balik na yung mga risk factors. But, be sure that all these risk factors must be safe. Kasi, ito yung malapit sa panganib, malapit sa sakit na to. Like for example, the sexual intercourse with infected individuals, kapag infected yung isang yun, magiging infected ka rin, makukontaminate ka through sexual intercourse. If you are not wearing the safe gamit para makipagtalik sa isang partner mo without knowing na positive pala siya, then you'll not be in a safe way makipagtalik sa partner mo. Okay? Next is hemodialysis. And then occupational exposure to injected individuals and blood products. Next, the medical intervention. There is currently no cure for hepatitis D, diba? But treatment can help people manage the condition. Yes, for those people with chronic hepatitis D, a doctor will often prescribe a medicine called pegylated or pegylated interferon alpha. which reduces the risk of the conditions worsening. Para hindi lumala yung condition mo about the hepatitis is kailangan mag-take ng gantong gamot like the pegylated or pegylated interferon alpha. Okay? So, which is people will usually take this for at least 48 weeks. Next, the targeting the causative agent of hepatitis B or Hep B may also kill the causative agent of Hep B. Hep D. Next tayo is nursing intervention. Inform the patient and a family member about the nature of the disease if the patient is taken care at home. Assess the paracentesis if indicated. Nasabi ko na to kanina, di ba? About this nursing interventions. This is also magkapareho din sa other viruses or the hepatitis diseases virus na mention ko kanina. Magkakapareho din yung nursing interventions and others like medical intervention, pwede mga risk factors, kumbaga may pagka-similarity pa rin sila sa other viruses. Next is the patient with cirrhosis, cold B and deep pain and discomfort. Use of the analgesic should be administered with great caution since it can worsen the liver damage. Masakit siya pag naging worse na yung damage ng liver natin. So, the patient must be use the analgesic. Next is the diversionary therapy. A non-pharmacological approach should be applied in managing pain. Next, ongoing, the monitoring of vital signs. Check your vital signs of that patient. If it systolic or diastolic, also the pulse rate and respiration, and then abdominal girth, and reminding for the routine checkup must be emphasized for effective management. So, yun. Next tayo is the hepatitis E virus, which is the function. It is believed that HEV is transmitted by the fecal oral route. Yes, the fecal oral route. Then, principally through contaminated water and areas with poor sanitation. Poor sanitation, like for example, iinom ka ng tubig without knowing na yung tubig pala is hindi malinis, di ba? Mayroon ganyan yan. And then in general, hepatitis E resembles hepatitis A chronic form 2 do not develop. So, what are those causes for the hepatitis E virus? HEV or hepatitis E virus is found in the stool of an infected person. Like what I've mentioned previously, like kapag naapakan mo yung tayo ng infected person, nadala mo sa bahay mo, tapos yung anak mo, pinaglaruan yung tsinelas mo, yung tendency without knowing that the baby or yung bata is, andun na pala yung virus sa kamay niya. And then, without knowing na kumakain na pala siya nung mga candies or kung ano, without notice, hindi mo na notice yung bata is humawak sa tsinelas mo. And then, kumain siya ng mga candies without hand sanitation. Kasi, you thought na kapag yung bata is hindi naka-ano ng tsinelas mo. Nakawag yung tsinelas mo. Kumain siya. And then, yung virus na sa kamay niya is mapupunta na sa bibig niya until mag-spread na siya at napupunta na siya sa liver. So, or ikaw din naman yung nakahawak nun, di ba? So, make it sure that when you are going home with your chinelas or whatsoever, dapat is wag mong ilagay kung saan dapat in a practical way para hindi ka makontaminate, hindi makontaminate yung family mo. Okay? Next is it is spread when someone knowingly ingests the virus, even eat microscopic amounts. Next, Next tayo, hepatitis D virus and GB virus C. Yes. The function is it has long been believed that there is another non-AE agent causing hepatitis in humans. So the incubation period for post transfusion hepatitis is 14 to 145 days. Tagal, di ba? Kaya dapat ingat-ingat para hindi ka mag-suffer. So next is tulong for hepatitis B or C. So what are these causes? Spread by infected blood or blood products, same cause and similar from the other viruses, okay? It can be transmitted by sharing personal items contaminated with the virus. And then mother to newborn child at birth. Sinabi ko na rin kanina, like mahawaan yung bata kapag yung mother is positive, paglabas ng bata, positive na siya. So that's why they need the immunization, yung bata. And then next is or by the sexual activities. Sexual activities contaminated from that one person, and then even if you're not contaminated, you will be contaminated if that person you have sex with is positive. Okay? Next is signs and symptoms. Fatigue, flu-like symptoms, dark urine, light colored stools, fever, jaundice. So the prevention is that if you are regularly exposed to blood or blood products from others, try to protect yourself with gloves to reduce the risk of the spread of viruses. Pag remove mo ng gloves mo, nandun yung viruses of gloves. Diba? Now, what more pa kaya pag yung kamay mo lang yung ginamit? Imbis na nandun dapat sa gloves, punta na sa kamay mo. Then, without even having the proper sanitation, then the tendency will be contaminated. Next is if you are injection drugs, ensure you use clean or sterile needles. Must be followed, okay? The risk factors, same as the hepatitis C, what I've mentioned earlier. So that's all for this topic, and the other is will continue to Mr. Insail.